Well, good afternoon and welcome back to another TDSS Practice Management and Billing webinar. Um, Today we've got a new format. We're doing something different. We're going to do a podcast slideshow, and we're going to share that with y'all. And it's based on a new training manual, the First Appointment Advantage, which was formerly the scheduling of the First Appointment manual. So we've got a new manual out. We'll get that out to you. We feel like this is a pretty comprehensive update, and this version contains a lot of information around turning that initial patient inquiry into a lasting relationship. We're going to distribute this the way we have the others using our ebook system called Flipping Book. And something I want you to know is in Flipping Book, you can make comments while you're going through it. You can have comments or questions. And as you put those in there, we'll get that feedback and respond to it appropriately. If you've got any current questions as we're going through this one, please add them in your chat. And then we're going to be sending out that Flipping Book. And we're going to also add this webinar to the website so you can view it later or others can. And next week, we're going to go over the medical records in our next session. So be sure to join us then. I'm going to go ahead and share my screen and start the slideshow and video for you all.
Welcome to the deep dive. Today, we're venturing into some really interesting material.
Yeah, what have we got?
It's a training module titled The First Appointment Advantage.
Okay.
Comes from the experts at Texas Dental Sleep Services. That's Martin Denbar, DDS, and Eric Northey.
Ah, PDSS.
Right. And look, this isn't your typical, broad business advice. It's very tightly focused on how dental practices, specifically the ones in their network, can really nail that initial connection with patients.
Patients dealing with obstructive sleep apnea, I assume.
Exactly, OSA. And specifically when the treatment is oral appliance therapy.
Gotcha. So very niche.
Very. We're looking at their latest draft from April 2025. Our goal today, pull out the core insights about, effective patient engagement in this particular healthcare space.
Makes sense. So we're digging into something meant for their internal teams, right? TDSS providers.
Precisely.
And it covers the whole journey from first contact.
The whole thing. First call, understanding treatment, navigating costs, all of it.
Okay. And the core idea is building trust.
Seems to be. Trust through clear, empathetic communication. The aim is, better patient results, a better long-term care experience.
That foundation of trust is so critical in healthcare.
Definitely. And they also mentioned something about a new system coming online soon.
Yeah, June 2025. A lead capture and automated email system shows they're thinking proactively about outreach.
Right, staying ahead. Now, for you, our listener, even if you're not in dentistry.
Oh, yeah, definitely.
I think you'll find this really insightful. We're talking fundamental principles here.
Building trust, addressing concerns, guiding someone through a process.
With clear info. Skills that apply almost anywhere, really.
Absolutely.
So we'll break down their key stages, highlight some pretty smart techniques they suggest.
Sounds good. Where do we start? The core workflow.
Let's do it. They have the central 6-step process.
Right. And what's interesting is they say it applies no matter how the patient finds them. It's the backbone.
Okay, step 1.
Collecting medical insurance information. And they really stress doing this upfront, verifying it immediately.
To avoid surprises down the line.
Exactly. No unexpected bills. That builds confidence right away. It makes the whole experience more predictable, more transparent.
Yeah, nobody likes financial shocks, especially with healthcare stuff. Okay, after insurance.
Step 2. Scheduling that first appointment.
Straightforward.
Well, yes and no. They make a key distinction. Is it a consultation for someone undiagnosed? Or a full evaluation if they already have a doctor's order for treatment?
So they tailor it right from the scheduling.
Seems like it. Manages expectations, uses time well. Then step 3 is sending out patient questionnaires.
And getting those back early is important.
Crucial, they say. It lets the practice personalize the exam, tailor it to that specific patient's history and needs.
Okay, so preparation, personalization makes sense. What about step 4? Preparing for the exam.
Right, this is where a lot happens behind the scenes. Re-verifying insurance benefits.
Again, just to be sure.
It's like it. And getting a good faith estimate. That's tied to the No Surprises Act.
Ah, the transparency thing, like getting a quote up front.
Exactly. So patients know the potential costs. They also gather notes from the referring physician, if there is one, and confirm the doctor's order is actually in place. Unless it's VA, that's slightly different.
So a lot of ducks need to be in a row before the patient even sits in the chair.
Precisely. It ensures that evaluation time is used effectively.
Okay, groundwork laid. Step 5 must be the exam itself.
It is. And here, the focus shifts. Building rapport, tailoring the conversation based on those questionnaires and notes.
Making it personal.
Exactly. Addressing their specific experiences and concerns directly.
And the final step, step 6.
That's got 2 parts. First, the doctor presents the treatment options based on everything they've found.
Okay.
Then, a financial coordinator steps in. They handle the cost discussion, the payment options.
Separating the clinical and financial talks. Smart.
Yeah, lets the patient absorb the medical side first, then focus on the practicalities.
Okay, so that's the core 6-step framework, but you mentioned patients come from different places, these source pathways.
Exactly. They outline 4 main routes into this workflow.
Yeah.
First, their current dental patients.
People already coming in for checkups.
Right. Maybe during a routine visit, they screen for OSA signs. If something flags, collect insurance, then refer for a telemedicine consult.
Telemedicine. Convenient first step for existing patients.
Seems like it. Low pressure.
What about referrals from, say, medical doctors?
Okay, medical and TRICARE community referrals. These folks usually arrive with a physician's order.
So they're already diagnosed.
Typically. So the focus shifts. Gauge what they already know about oral appliances, then schedule that in-office evaluation pretty quickly.
Get things moving because they're further along.
Exactly. More direct paths for them.
Makes sense. And VA referrals, you mentioned they're a bit different.
Yeah, often a big advantage here. Full coverage, no copay frequently.
So smoother sailing.
Often allows for immediate scheduling of the first exam. Very streamlined.
What if a vet isn't diagnosed yet?
Good question. The module addresses that. They offer a $50 consultation specifically to help guide the veteran through the VA system.
To get the diagnosis.
Right. Get the diagnosis via the VA, then circle back to the practice for treatment.
Wow, that's really proactive, helping them navigate the system.
It shows a real commitment to access, doesn't it? Addressing a specific barrier for veterans.
Definitely. Okay, and the last pathway.
Marketing leads. People finding them through their website, ads, social media, general public.
And for them.
Similar initial step, a $50 consultation offer. If OSA is suspected and then diagnosed after that, they move into the standard evaluation process.
So everyone, regardless of how they start, eventually merges onto that main 6-step track.
That's the idea. A consistent process once they're in the system.
Now, you mentioned the first call earlier. The module really highlights that, doesn't it?
Absolutely. That initial phone interaction. They see it as critical, setting the tone, building that connection.
And they have specific techniques.
They do. They strongly recommend empathy, obviously, but also a specific framework called Feel, Felt, Found.
Feel, felt, found. Okay, break that down for us.
Sure. So if a patient expresses a concern maybe about treatment or how tired they are, first you validate it. I can relate to how frustrating this must feel. That's the feel.
Acknowledge their feeling.
Right. Then you normalize it. Many patients have felt the same way before starting treatment. That's felt. Shows they aren't alone.
Okay. Feel, felt.
And finally, found. Offer the positive outcome. They found that our oral appliance options significantly improve their sleep and quality of life.
Ah, so you connect, normalize, then offer hope or a solution based on others' experiences.
Exactly. It's about empathy and social proof.
Yeah.
Making them feel heard and showing positive outcomes are possible. Really effective.
Sounds powerful. What else about that first call?
Big emphasis on explaining the value of that first appointment before discussing fees.
Value before cost.
Right. Clearly explain what they get. Education, screening in a consult, or diagnosis review and treatment options in an evaluation. Show the benefit first.
Makes sense. You want them to see what they're investing in. What about if someone calls who isn't diagnosed yet?
Good point. For them, they schedule that consultation. It's clearly positioned as non-diagnostic.
Okay.
The goal is education, screening, assessing if an appliance might be suitable, and then crucially referring them for a proper sleep study, often via telemedicine.
So it's step 1 in getting diagnosed and exploring options.
Precisely. And they mentioned collecting a consultation fee or copay is standard for this visit.
Got it. Now let's talk money. Often the tricky part. The module tackles communicating costs.
It does head on with confidence is the idea. Big focus on transparency and managing expectations from the get-go.
How do they suggest doing that?
Well, first, clearly define the deliverables for that initial visit. What exactly does the consultation fee or evaluation fee cover? Justify the cost by outlining the service.
Setting clear expectations again.
Exactly. They also suggest asking for the copay amount fairly early, but linking it directly to verifying their insurance.
So it's framed as part of the process. To check your benefits, I'll need your copay amount.
Something like that. Makes it feel less like just asking for money, more like facilitating the insurance side.
Smart phrasing. What if someone pushes for the total treatment cost right away on that first call?
Yeah, that happens. Their advice is to, strategically defer it, give a general range maybe.
Maybe tiny range.
They mention figures like $3,000 to $5,000 total, with typical out-of-pocket maybe $500 to $1,200.
Yeah.
But heavily emphasize.
That depends.
Exactly. It depends on the exam findings, their specific insurance. A precise quote isn't possible until after the evaluation. The goal is getting them in for that assessment first.
So give a ballpark, but manage expectations that it's not final until later. What about easing financial concerns? People worrying they can't afford it.
They have several reassurance points ready. Emphasize it's doctor-directed care, so it's clinically necessary. Highlight that the practice works hard to maximize insurance benefits. Mention payment plans are available. And promise complete transparency, no hidden costs.
So the message is, we'll help you figure this out.
Pretty much. Support and transparency on the financial side.
Okay. Moving on to guiding the patient through the process, especially leading up to that first appointment. What's the focus there?
Proactive communication, setting clear expectations. They recommend confirming appointment details beforehand.
Standard stuff.
Yes, but also reassuring the patient that the office handles the paperwork hassle documentation, insurance authorizations, benefit checks.
Taking that burden off the patient, that's huge.
It really is. Makes the whole thing feel less overwhelming, less daunting.
Definitely.
And they provide actual scripts for explaining what happens during a consultation versus an evaluation.
So everyone's on the same page.
Right, for consults, education, screening,
Yeah.
for evaluations, reviewing the diagnosis, developing the plan.
Yeah.
And they specifically mention no device fitting happens at that first evaluation.
Managing expectations again. Good. What about after the evaluation?
Clear process outlined. First, doctor presents treatment options, clinical discussion. Then, that separate financial chat with the coordinator. They present the good faith estimate, go over insurance details, payment solutions.
Keeping clinical and financial separate but clear.
Seems designed to help the patient process everything without feeling overloaded. Very step by step.
Makes sense. But sometimes patients hesitate. They have objections. Does the final module cover that?
It does. And interestingly, they frame a no as not yet.
Not giving up easily.
Right. Emphasis on follow-up. Strategies for re-engaging patients who initially decline. Persistence.
Okay. What about the big one? Cost objections.
Address it directly.
Ah.
Offer to explore all the financial options. They find patients are often surprised it's more affordable than they thought.
So have payment plans, financing info ready.
Exactly. Be prepared to discuss solutions, stay updated on insurance changes, shift the mindset from I can't afford this to how can we make this work?
Finding solutions together. Nice. They also mention an enhanced value proposition. 5 pillars.
Yeah, this is where they really spell out the overall benefits of oral appliance therapy. It's not just about stopping snoring.
Go deeper.
Right. Pillar 1, comfort, custom fit, often preferred over CPAP. Pillar 2, effectiveness up to 80% success rate mentioned. Pillar 3, convenient, small, easy to travel with.
Okay.
Pillar 4, cost reiterating affordability with insurance and financing. And Pillar 5, health benefits, reducing risks of serious stuff like high blood pressure, heart disease.
So painting that whole picture, comfort, effectiveness, convenience, cost, and health.
Exactly. Giving the team talking points for each to really sell the value.
And the final piece for overcoming objections, using success stories.
Absolutely. They stress how powerful, relatable testimonials are. Real patients, real results.
Like someone who struggled with CPAP or fatigue.
Precisely. Use stories that mirror common concerns. They even give an example talking point, someone whose energy, mood, even marriage improved. And they encourage practices to collect their own stories to make it even more personal and impactful. Right. Real-world proof is persuasive.
No doubt about that. Okay, we've really unpacked this first appointment advantage module. Stepping back, what are the main takeaways for you?
I think what stands out is how structured, yet also how empathetic this approach is, especially for such a specialized area like dental sleep medicine.
Yeah.
That relentless focus on clear communication, understanding patient concerns upfront, tackling the financial piece proactively. These are solid principles for building trust anywhere in healthcare, really.
I agree.
And tailoring the communication based on how the patient arrived.
Yeah.
That shows a sophisticated understanding of different patient needs. It's quite impressive.
Yeah, for me, a couple of things really jumped out. That feel, felt, found framework, simple, but seems incredibly effective for building rapport immediately.
Mm-hmm.
And the detailed scripts for handling cost questions. That transparency and confidence is key. Plus, that specific strategy for VA referrals helping them navigate the system really shows a commitment to access.
Definitely a standout point. And, looking at this internal document, the level of detail, it makes you wonder, doesn't it?
How so?
How often do we, as patients or just consumers, actually experience this level of proactive, transparent, empathetic guidance?
Not often enough, probably.
Right. What could other industries learn from this kind of structured, patient-first approach to building confidence and ultimately long-term relationships?
That is some good food for thought. So for you listening, if this deep dive sparks some ideas about patient or customer engagement.
Yeah, think about how these principles, clear communication, addressing concerns, transparency, might apply in your world.
Whether you're a provider, a consumer, whatever, what techniques resonated, how could you adapt them?
And maybe digging a bit more into the No Surprises Act, or just the general impact of clear communication in healthcare could be a valuable next step for you.
Absolutely. Well, thanks for joining us for this deep dive.
So that was the podcast and slideshow. We're going to be sending out the document this afternoon via the flipping book, and you can go through that. It's about 40 pages or so, really comprehensive. There's an appendix with like a one-page guide for Medicare patients. It's got in the appendix, it's got how to discuss the copay and how to discuss either going to balance bill the copay or the exam visit, or you're going to apply it to the treatment if they move forward. And there's details. It's detailed in there for that based on the carrier and based on their decision to move forward. If you do a consult fee, we recommend you just do the consult fee as is. There's room in this process for you to tailor it, some of the details to fit your practice and your marketplace. Some clarifications. The folks that did the podcast got a couple of things that I wish we could have done over, but I think they said re-verify, and really what they were talking about was the VOB, getting the VOB right. I also want to take a moment on the feel, felt, found technique. It is a tremendous technique for any time you have to deal with a patient or a client, and first saying you understand how they feel, whatever the issue is. Just take a moment. And it's not really manipulative. It's really attitudinal. If you take the time to listen to what they said, how they're expressing their feelings, and then tell them, I understand how you feel. And then think about it. Can you relate it to some other experiences you've had with other people or yourself? So, I understand how you feel. Others have felt the same way. I've felt the same way, however that goes. Those two steps in this attitude that you present to the patient or the client opens it up, gets rid of the defensiveness. And then when you say, and what they found was, and in that case, we're offering a solution that may resonate with them. But what I think it feels like to them is that you've gotten on the same side of the issue with them and helping guide them through that. Again, in this document, there's a bunch of items in the appendix. There's going to be the ABM that you need to use sometimes. We're adding a few of these documents we've got a number of these documents already in the provider packet, but we'll send that out this afternoon also. I also want to say that we're going to go ahead and get these sent out. There's more changes we want to make to them, but we'll make those changes later and update those. And it's one of the nice things about the flipping book is we can update them on the fly. And the next time you log in, those changes will be in the book. So that'll be nice. And then another thing is if anybody has any questions now, great. If not, we're just going to close. I'll say two things. Again, next week, we're going to go over the medical records. Ariel will do that. And then the week after, we're going to go over a process for navigating the VA healthcare system. Part of that goes back to why, if you've got a VA patient that's going to come into your practice, but they haven't been diagnosed, some people might say, well, just they have to get diagnosed and referred. That's what they might say to you. So just send them over to the VA system. If you send them over to the VA system at that point, it's a black hole. You'll probably never see that vet again. So you bring them into the office, you do a consult, you just sort of talk to them about the health risks of untreated sleep apnea, find out what their current condition is, get to know them. These consult visits and these first visits are a great time to build rapport with that patient, build a relationship. That's really important. And then in this document we're going to go through, you're going to have the tools to help guide them through the VA system, because the VA system is going to try and trap them, whether it's intentional or not. They trap the vet. And we know vets who've had their sleep appointments canceled. They were scheduled out 6 months and then they got canceled. And then they got scheduled out 6 more months and they got canceled again. So we're talking a year and they haven't even had a sleep test. And the same thing's true for the oral appliance therapy. They may never get back to you. And if they do end up getting oral appliance therapy, but you haven't helped them navigate, they're going to go to some other doctor who does oral appliances, not you. So again, this is really important. You take a chance to build that relationship and to help get them back to your practice. So lots of things in this. We're super excited about the manual. The manual is in, I think it's 6 modules, and each one has an objective and a summary and a quiz at the end. And again, that appendix with a lot of other information. So we hope it's really helpful. Really appreciate your time today, and we will see you next week.